the last couple months, I've learned a lot about Parkinson's disease. I never understood it myself, and I didn't understand how serious it was until I really started researching it and interacting with people who had it. It was something I found really interesting to learn about, so whether this is new information to you or not, I hope you find it just as interesting and informative as I did. Most people might underestimate the amount of people diagnosed with Parkinson's disease. They may not understand the toll it takes on people. After this speech, you should have a better understanding about Parkinson's disease, how it's treated, what it affects, and my personal experience with Parkinson's. What is Parkinson's disease and what causes it? It's a neurodegenerative disorder where the body stops producing dopamine. Common symptoms are shuffled gait, tremors of the hands, masked facial expressions, and slowed movements. A lot of people with Parkinson's have depression and decreased motivation, referred to as apathy, unintentional decrease in motivation. And this is the area of the brain that it's all started at. And it's sending signals to the rest of the body, and that's what's causing the tremors of the hands. Though Parkinson's normally affects older people, it has no age limit and can affect someone at any age. As of 2002, there were about 500,000 people in the United States with Parkinson's and about 50,000 new cases annually. Some of the causes for Parkinsonism include prescription drugs, use of illegal drugs, environmental toxins, head trauma, strokes, and many more. Parkinson's disease can make it difficult for a person affected to complete daily routines such as fine motor tasks. Based on the severity, some can't bathe or dress themselves. There's 5 stages of Parkinson's disease, and in later stages, they may need help with toileting tasks too. Though there is no cure, there is treatment out there for Parkinson's disease. It is a lifelong disease, but there are treatments out there that can help reduce the trembles of Parkinson's disease. Some people can also do deep brain stimulation surgery where they insert probes into parts of the brain, and that will reduce the severity of the tremors. Research is starting to show that high-intensity exercise helps slow the progression of Parkinson's disease. I've done a lot of research on Parkinson's disease prior to this assignment and thought it was something important to talk about. My sister is an occupational therapist, and all of her studies in the last year have been about Parkinson's. I've attended yoga with a group of people that had Parkinson's as well, and yoga is one of the most beneficial complementary therapies for Parkinson's disease. It helps increase flexibility, improve posture, loosen tight, painful muscles, build or rebuild confidence, and through these benefits, enhance their quality of life. There were specific exercises we did for them, and they have noticed a huge difference in their body, their balance, coordination, and reduced tremors after numerous yoga sessions. I did find that some of them were having trouble keeping their balance, but then there were some that were way more flexible and active than me. I hope that after watching my speech, you have a better understanding on what Parkinson's is, how it affects people, and the treatments on Parkinson's. Health is something that everyone should take seriously, and it doesn't hurt to have as much information as possible about any disease out there. I've learned firsthand about just how much it's changed the lives of those affected. It makes me so happy that those affected that I've met through yoga have came together to do something about it and make their lives less difficult and improve their quality of life. I found all of my information in the Tennessee Tribune, Obesity, Fitness, and Wellness Week, and the Timuru Herald, and of course my personal experience and my sister, whom is an occupational therapist.